They're taking the pulse of America, and polls show 72% of those surveyed think the U.S. healthcare system needs mending. I'm Naomi Binkley with Fireside Production. Here at the University of Denver for a quick fire with Professor Tom Russell. This is Healthcare Reform 101. What's the difference between single payer and the public option?
What a single payer plan does is pays for medical care from a single source. And that single source could be anything. It could be the government, but it doesn't have to be the government. It could be a nonprofit corporation, for example. It could be a private individual who wants to pay for our health care. It simply means that all the payments come from one source, which means all the bills go to one source. A public option is different. What a public option would be one payor that is run by the government, managed by the government, and then in addition to the public option, there would be many other payors, many private payors. Generally, the biggest benefit for a single payer program is that it reduces administrative and overhead costs. It's much simpler if medical providers can bill a single source. A public option would benefit people because when the government is the payor, the administrative costs go down. With Medicare, for example, the administrative costs are about 3 to 5% of the program. With for-profit private health insurers, the administrative costs are typically 20 to 30%. So first, the public option would be beneficial in reducing the cost, right? And then as well, it would bring competition to the private health insurers that would force them to become more efficient.
What is socialized care?
In a socialized system, the doctors would work for the government. And that's not what anybody is talking about. We're mostly talking about simplifying and reducing the cost of payment mechanisms. In Britain, for example, the doctors work for the government and they're paid by the government. That's socialized medicine. And no one is saying that we move in that direction.
How does Canadian care differ from the current U.S. healthcare system?
Everyone in Canada has healthcare. In the United States, 47 million people, and that number grows daily, have no access to healthcare. Okay? They're uninsured and therefore have no access to healthcare. The second thing to know is that in the United States, we pay more than $8,000 per capita for the health care that we do get. So more than $8,000 for every American. In Canada, by contrast, Canada spends 43% of what the United States spends on health care. So they spend less than half, less than $4,000 per person, really closer to $3,000 per person. And they cover everyone.
What impact would these options have on the economy?
Significant healthcare reform would be a tremendous boon to the economy. Right now, if you take the figures for our economy as a whole, we spend 16 or 17% of our gross domestic product on healthcare. Other countries spend in the range in the single digits, 8, 9%, maybe 10% on healthcare. If we didn't have these excessive costs spent on healthcare, then we could use that money to generate things that we need that are more important to the economy. We could also help businesses, small and large businesses, compete.
Is healthcare reform possible without campaign finance reform?
Nationally, I'm not sure that it is. In Washington, D.C., the strength of the lobbyists paid for by big medical, be that big pharma, or be that other aspects, particularly the lobbyists for private health insurers, I think are managing right now to push meaningful reform either off the table or make it exceedingly difficult. Within the states, though, I think there is a real possibility and more of a possibility for meaningful healthcare reform. And part of the reason for that is in Colorado, where I live at least, the biggest private health insurers and big pharma do not have the power that they do in Washington, D.C.
We're told the most effective way to make your opinion known is to actually pick up the phone and call your representatives and senators. And be sure to send us your idea for our next Fireside feature. Become a Fireside Production fan on Facebook and follow us on Twitter.